I had a normal pregnancy. Everything was going along great. All my ultrasounds were looking wonderful. But shortly after Lucas was born, he had heart murmur. They did some additional testing, and we got a diagnosis of a congenital heart defect, which I guess I was devastated. I didn't know what it meant, what his long-term implications would be.
One of the most difficult things was certainly balancing the joy of having a new baby boy and having a healthy birth and pregnancy all along, but then certainly the emotions without Lucas being in our room and being near him and realizing that there were more tests going on.
Just thinking about that day when we had to leave him with the team, it was probably the hardest thing, having to give my baby up. And, hi honey. Having to give him over to the surgeons and the anesthesiologist. It was a hard day for Mommy to see him go into surgery knowing that there was nothing more that I could do for him and that he was truly in the doctor's hands.
Nobody ever likes to hear that their child has a hole in the heart. Lucas's family was like many families I've seen over the years. They're scared. To come to see a heart doctor is always a scary thing, particularly if you have an idea that your child might have something wrong. I saw Lucas once a month to make sure that the family had their questions answered, that there were no new questions that had arisen.
She answered all of our questions. She answered questions we didn't even know how to ask.
I always offer them a chance to meet with a surgeon. We always offer them a chance to tour the ICU. It's a beautiful ICU with individual beds, all state-of-the-art equipment, and I like families to see that people are going to take very good care of their child. And so I try to treat the patients as if they were my own family member. I have a sister with heart disease. I have a father with heart disease, and I think it can be very scary when you're the family. And I would want people to get excellent care. I'd want excellent care for my own child, and that's really how I try to approach each family.
We are so lucky that we have such an amazing hospital so close to us and our community. We are so lucky. Everyone has been amazing. The doctors, nurses, everyone has just been incredible.
I've seen Lucas most recently in October at about 1.5 years of age. He looks beautiful, is growing well, developing beautifully. He will still need to be followed, as are all the children with tetralogy of Fallot.
We're very hopeful and we don't know what the future has to come. Lucas's surgery is complete and it's really going to be a lifetime of monitoring for him.
Hopefully he won't need another open heart surgery, and we're just going to live every day to the fullest and love our boy and just celebrate the life that we do have.